I'm going to get to introduce our first panelist, who's Jeane Whaling, who is a nurse at Lawrence Memorial Hospital and a member of Local 5049 AFT Connecticut. And so, welcome, Jeane. Let's hopefully make sure that we can hear you, and we're so happy to have you here.
Hello, good afternoon. Can you hear me?
Yeah, we can hear you. It's great.
Okay.
Great.
Today I'm coming to you as the political action liaison for Local 5049. I've been in that role, elected into that role approximately 4 years. This May Day rally couldn't come at a more poignant time right now. We've watched COVID-19 come alive in Wuhan, China. We've watched the spread of the virus wide and far. We have listened to their cries for help as each person became infected and as we've lost too many loved ones. This virus has spread to over 200 countries and islands, yet the United States of America leads the way in the world number of cases. We have over 1.1 million patients. We have over 67,000 Americans that have died due to this virus. My question to you is why? Why when we are the United States of America? When this virus hit our shores, it was no longer a hoax. We were unprepared. We did not have enough adequate PPE, and our CDC lowered the classification from the virus being airborne to droplet. When you think of airborne, think of tuberculosis. It's tiny particles that with one cough or sneeze spread wide and far. When you think of droplet, think of the influenza virus. It's larger droplets that fall close. This one change put all the lives of the Americans at risk. What does the public hear? Stay home, stay safe. Quarantine for 14 days should you or your family member get sick. This will flatten the curve. This will save lives. What did we do? States closed, businesses closed to essential only. Schools are now being taught at home. Americans are working from home, they're educating from home. We are celebrating via Zoom. We are doing drive-by parades. We are not going to visit our most vulnerable loved ones for the fear that this virus will kill them. I want to thank you all for doing your part. You truly are saving lives. I wish I could say the same thing about us in the hospital. When we all applied for a position in a healthcare industry, we all are vowing to save lives, from the lowest job to the CEO and all in between. I have read the Nightingale Pledge at 2 different pinning ceremonies. It's the core of who we are as a healthcare professional. By the CDC changing the standards, we are doing harm. We are spreading the virus. Before COVID-19, 1 mask, 1 patient. It was applied before entering the room and removed with an exit of the room. Now we are wearing, that's what we were taught to do. Not with this PPE, we are taught that you are protecting yourself and you are also protecting all your other patients that you will be seeing. Currently, with the hospital, with the CDC and the DPH guidelines being lowered, in the beginning we were given 1 mask to last indefinitely. So what does that mean? We spread the virus indefinitely. We have now moved up to 1 mask per shift. We are still sharing that virus. They immediately went to crisis mode. They didn't go through the chain of command. We have approximately 30 patients right now that have tested positive. All of our PPE is locked up. We have no access. It's locked in a manager's closet, and they are told to let out for 24 hours use. Typically, PPE is in a caddy besides each person's room that would need it, and you would have free access to it at all times. Right now, the N95 masks that you all hear about, those are only being used on the COVID floor, ICU, in the ER for the positive and the rule-out patients. We apply these masks at the beginning of our shift, and we don't remove them to the end of our shift. Another thing, we aren't being told if we're being exposed. which also means that we cannot quarantine should we be exposed. That's another thing that we're being told. So if a patient tests positive, we no longer know. We would send someone off to the COVID floor or to the ICU if should they be declining. I have no idea if that patient tests positive. Again, by doing this, we are failing them. We are doing harm. With each exposure, we are not only increasing our viral load, but we're also increasing the risk for infection. More than 6 weeks ago, all 3 locals at L&M, the RN local 5049, the tech local 5051, and the healthcare local 5123, asked to negotiate. The hospital ignored our request over and over until they wanted to mandate nurses. Mandate nurses to the hotbed of Greenwich and Bridgeport. We accepted their offer to bargain. We stood hard and we stood firm with our members in their concern regarding mandate. The hospital backed down on the mandate portion only. We still have not come to a memorandum of understanding in regarding to adequate PPE, safety, incentive for this time during the pandemic, workers' compensation, paid time off should you get sick or be on quarantine and not having to use your own time, and not eating up FEMLA. We are working around the clock to keep our patients, our members, and the community safe. Remember, stay safe, stay home, and wash your hands. Thank you.
Wow, Jeane, thank you so much. So glad you're here. And so the next slide is going to be our action supporting frontline workers and communities and asking billionaires to pay their fair share in this crisis. Thank you, Jeane, so much for your service and for sharing the news from the front lines of this site. We really appreciate your work every single day.